Tillman from Blount Memorial. She's sharing nutrition tips for a healthy heart. Good morning.
Good morning.
How are you this morning?
I'm good.
Happy Friday.
Happy Friday.
It's going to be
yes.
nice out, right?
I'm excited.
Oh, talk about getting a healthy heart. Good day to get out and exercise.
Absolutely. Absolutely.
Because you're not going to want to do that this weekend unless you're on a treadmill. But let's talk food, because there are certain foods that do help our hearts.
Absolutely. And we know that heart disease is the leading cause of death in the U.S. for both men and women.
That's crazy.
And there's certain things that we can't change. We know that as we age, that increases our risk. We know that our family history and genetic predisposition can increase our risk. But we can change some things to really prevent heart disease, reduce our risk. Things like not smoking, things like losing a bit of weight if we know we've gained some weight, things like exercise, physical activity, managing stress, and making some healthy eating changes. So I want to talk about sort of 4 areas that repeatedly in research are linked with better heart health and reducing a risk of heart disease.
Okay.
So first is choosing healthier fats. And there's 2 main kinds of fats that we want to think about getting in our diet. First is monounsaturated fats. So monounsaturated fats include things like olive oil, avocado oil, avocados, nuts, and seeds. And we see that monounsaturated fats seem to really help with lipid profiles, cholesterol profiles. They seem to help lower the bad cholesterol and possibly even raise the good cholesterol.
That's good.
Also omega-3 fats.
Right.
So we hear a lot about fatty fish, salmon, tuna, sardines, if you like those.
Yeah,
If you're not big on fish.
back in the camping days with my dad, I had to eat those, but okay.
So if not sardines,
Yeah.
tuna, salmon, chia seeds and flax seeds are also good sources of plant-based omega-3 fats. But I think we all just need to be thinking about how can we get more of these in our daily diet, because if you're not eating fatty fish or purposefully adding some chia or flax seeds, you're likely not getting you're getting a very low amount.
And it's not like you have to sit there and down a cup of chia seeds and try to choke it down.
Absolutely
Just
not.
a little bit of incorporation
Throw
here.
it-
You
I
can
throw it
hide
on-
them.
Yeah, I throw it onto a salad or into some oatmeal, flax. If you make a smoothie, ground flax goes really well in that.
There we
And
go.
have a tuna salad for lunch. Again, things that you can make pretty easy. Salmon for dinner one night, and you can get in some of that extra
And I know we
fish.
talk about this every once in a while, but you can incorporate this with your kids. Start them young.
Start them young and let them, keep putting it in front of them.
We try.
We go through the process, and it gets easier
Right,
with time.
right,
So
okay.
more healthy fats. Second is limit sodium. So the recommendation for sodium or salt is about 2,300 milligrams. That's the equivalent of a teaspoon.
A day?
A day.
That's
But-
a day? Some people put that on their one meal.
Right, so that's where we have to be careful. Now, I'll tell you that most people don't get that as much from salt shakers, but it's more from processed foods. So again, we're looking for less than 2,300 milligrams a day. Just to put in that perspective how easy it is to get that. This soup is 790, almost 800 milligrams in one serving. The can has 2 servings, so if you eat the whole thing, you've got 1,600 out of your 2,300 milligrams that you need. This
wow.
frozen dinner has 1,300. So you've got over half of your daily sodium. So packaged processed foods are the highest in sodium, so the more we can limit those, the better. Fast foods are really, some of them have over 2,300 milligrams.
In
even some
one
of the things that you think is
sitting.
healthy, like even some of the salads. So mostly sodium affects blood pressure. So if your blood pressure's high, pay more attention to sodium. Try to eat out less packaged
30
foods.
seconds.
Sugar has been linked to high triglycerides, which affects heart health. The recommendation is 6 teaspoons a day for women, 9 for men. This has 16 teaspoons in one 20-ounce Coke.
There we go.
And even 8 teaspoons. So we got to
That's
be
a
careful
lot,
with extra
yeah.
sugar. And then eat more fruits and vegetables. The
Fibers.
vitamins, minerals, fibers help lower blood pressure and also just help with healthy heart overall.
And you know what I did? I did this a couple of years ago, but I actually went to my doctor, got all my blood work done, found out where I was so I could gauge on my eating habits, went back 2 months later to get a recheck to see where I was, and it improved significantly based on a diet.
You can make a big difference. So that's a great important point. Know your numbers. Have
There
a
we
checkup
go.
every once in a while. Know what those numbers are, and make some healthy changes. Little baby steps. It doesn't have to be that challenging.
Right. Not like our New Year's resolutions where we got all in and it fails.
Baby
right?
steps.
Baby steps. Angie, thank you so
Thank
much.
you.
Have a great weekend,
Thank
by the
you.
way.
You too.
Good movie weekend, that's for sure.